Biden administration is recommending booster shots for all American adults. The World Health Organization has a very different message. They've asked for a moratorium on boosters until more people globally are able to get their first shots, pointing out that less than 2% of residents in low-income countries have been vaccinated. Earlier today, I spoke with the chief scientist of the WHO, Dr. Soumya Swaminathan.
Doctor, first off, let me thank you so much for joining us tonight. As we've discussed already, the WHO has asked for the very wealthy countries like the U.S. to hold off on those third booster shots at this particular time. But as you know, today the Biden administration announced that they're going to go forward with offering that third booster shot for every American starting the third week of September. What's your reaction to that?
So thank you so much for having me on the show and discussing this very important issue of vaccine equity. And as I think everyone recognizes now, vaccines are the tools, are the way that we're going to get out of this pandemic. And so it's really important that we get those vaccines to people all over the world to, first of all, prevent those who are at highest risk of dying. And sadly, today, 19 months into the pandemic, we are still seeing 8,000 to 9,000 deaths every day in different parts of the world, largely among the unvaccinated. So the WHO's point here is that let's get the primary dose of vaccines to people around the world. Now, if some countries start giving booster doses to their populations, what's going to happen is there's going to be an increased demand for supplies from these countries, which are mainly the high-income countries. 1 in 2 people in high-income countries have received at least 1 dose of the vaccine. And guess what that number is in the low-income countries? It's 1 in 55 or 1 in 60 people. So the vast majority of people there are just waiting for the vaccine supplies that haven't arrived. Now, there's also the science behind the boosters. The WHO just had a consultation on boosters, and the consensus was that there isn't enough evidence now to tell us who needs the boosters, when do they need them, against which variants are they needed, and which particular vaccines actually need boosting.
The White House, though, has said we can do both, right? We can protect Americans and offer that third shot, and we can also give to the rest of the world. Do you disagree with that idea of doing both?
We absolutely can see the point that political leaders want to protect their own citizens. However, we don't believe that the science has gotten to that point. And secondly, the issue of supplies is a very real one. I mean, if there were enough supplies of vaccines for everybody around the world, we wouldn't be in this situation today. COVAX is looking for supplies to send to African countries and other low and middle income countries so that they can step up their vaccination campaign. So I'm afraid that the possibility of boosters in some countries is going to mean that an additional 800 to 900 million vaccines are going to flow into high-income countries instead of flowing into the low and middle income countries through COVAX.
I've heard you say twice at this point that the science isn't there to say that we need those booster shots, or in some cases for some people their third shot. Now, the Biden administration is saying we're starting to see evidence of reduced protection against mild and moderate disease. Do you feel that that's not final enough?
It depends what we want these vaccines to do. Do we want them to protect 100% against infection? Well, most vaccines are not doing that at this point. We really didn't expect them to do that. I think we are delighted that the vaccines we have protect against severe disease and death. That's the outcome we want to prevent. If people are going to get a cold and a slight temperature and they have to take off for a day or two from work, I think we can live with that. What we cannot live with is the toll, the death toll that we're seeing today. Countries like in sub-Saharan Africa have lost the only neurologists, hematologists, and specialists they have. I mean, there are countries that have hardly a couple of specialists, and they've died taking care of patients with COVID. So all WHO is trying to say is, let's prevent these deaths. We have the tools today. And how is it possible? How can it be ethically and morally right that people can choose how many doses they want to get and sort of unlimited, and others must continue to lose their lives?
For the typical parent, for example, here in this country who says, look, I care about global equity, but my priority is my family, right? And so I want to make sure that we are as fully protected as possible before we go, you know, and try and save the world. How would you respond, or what would you say to that American?
I completely agree that everyone, you know, would want to protect themselves, their families, and their communities. There's absolutely nothing wrong with that. And I think we have a lot of work to do to convince those people who, at the moment, do not seem to want to take the vaccines to actually take the vaccines. However, we're in a pandemic, and we don't come out of a pandemic by handling this country by country, city by city, state by state. We come out of it when we have a global plan and when we stick to that plan. Sooner or later, we're going to get that next variant, which might be much worse than Delta and the other variants of concern we've had. And if that were to happen, then I'm sorry, but we'll be back to square one. So I think it's in everybody's self-interest, in the self-interest of those parents and those communities, to make sure that this doesn't happen. And the one way that we can make sure that these new dangerous variants do not arise is to get vaccines out everywhere as quickly as possible.
And you just touched on this. I've heard you say it before. The inequitable distribution of vaccines has allowed the virus to continue spreading. How concerned are you? And you touched on this for a little bit just now, but about the deadlier mutations, about the more contagious strains.
Well, we are very concerned. And, you know, the problem is there's no way of predicting what this virus is going to do next. The virus is looking to propagate itself. It's looking to survive. It's looking to evolve. This is what viruses do. They do things which are to their advantage. We should not be giving them an opportunity to do that because we have the tools and the science to prevent that. It's how we use those tools. We have the treatments. We have the other public health and social measures, the masking and the distancing and all of those, the testing, all of that helps. So it's a package, but vaccines are an important part of that package of tools that we have. If there's something that gives me sleepless nights, it's the thought of another variant that's very different and that's able to evade the immunity that these vaccines have given us. And then we just start all over again.
And before I let you go, I just want to ask, at what point would you personally even consider getting a third shot or a booster shot?
I'm in no hurry to get my third shot. I think there are people on the front lines who need it more than I do. And I will wait for the science. Of course, I'm interested in the science. And eventually it may be that some people need boosters, you know, the elderly, for example. So we need to watch that space, do the research, do the studies that are needed. And at some point, if it appears that somebody of my age should take a booster, maybe, you know, I will consider that. Certainly not now. Certainly not till we've achieved the goals that WHO has set out for the world.
Doctor, thank you very, very much for your time. So grateful for that.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.